What is a potential complication of weaning from CPB if adequate myocardial oxygen delivery is not ensured? A. Renal failure. B. Myocardial infarction. C. Hyperglycemia. D. Cerebral edema. Answer: B. Myocardial infarction. Explanation: if myocardial oxygen delivery is inadequate during the weaning process, it can lead to myocardial ischemia and potentially result in a myocardial infarction. Ensuring adequate coronary perfusion and oxygenation is crucial to prevent this complication. During weaning, if a patient's cardiac output is insufficient, what is the initial intervention to support the heart? A. Increase the heparin dose. B. Administer vasopressors. C. Start diuretics. D. Administer inotropic agents. Answer: D. Administer inotropic agents. Explanation: if cardiac output is insufficient during the weaning process, inotropic agents are typically administered to support myocardial contractility. These agents help improve the heart's ability to pump blood effectively, thus supporting hemodynamic stability. What is the primary cause of low cardiac output syndrome during weaning from cardiopulmonary bypass? A. Excessive fluid retention. B. Myocardial dysfunction. C. Electrolyte imbalance. D. Increased systemic vascular resistance. Answer: B. Myocardial dysfunction. Explanation: myocardial dysfunction is the primary cause of low cardiac output syndrome during weaning from CPB. The heart may struggle to regain normal function after being removed from the bypass machine, leading to insufficient cardiac output. This can be due to ischemia, reperfusion injury, or underlying heart disease. Which of the following is the most common cardiovascular complication during the weaning process from CPB? A. Atrial fibrillation. B. Myocardial infarction. C. Hypotension. D. Stroke. Answer: C. Hypotension. Explanation: hypotension is a common cardiovascular complication during the weaning process, often due to low systemic vascular resistance, myocardial depression, or fluid imbalance. Careful management of blood pressure is essential during this phase to ensure adequate perfusion. What is the role of a TEE, transesophageal echocardiogram, during weaning from CPB? A. To evaluate myocardial oxygen consumption. B. To assess left and right ventricular function. C. To measure the size of the heart chambers. D. To monitor coagulation levels. Answer: B. To assess left and right ventricular function. Explanation: TE is used during weaning from CPB to evaluate the function of both the left and right ventricles, assess for any valvular dysfunction, and check for any structural heart abnormalities. It helps determine if the heart is functioning well enough to support systemic circulation independently of the CPB machine. What is the role of the pulmonary artery catheter, Swan-Ganz catheter, during the weaning process from CPB? A. To monitor central venous pressure. B. To measure pulmonary artery pressures and cardiac output. C. To assess renal function. D. To monitor serum electrolyte levels. Answer: B. To measure pulmonary artery pressures and cardiac output. Explanation: the pulmonary artery catheter is used to directly measure pulmonary artery pressures and cardiac output. These measurements provide vital information about the heart's ability to pump blood and the adequacy of pulmonary circulation, which is essential during the weaning process. In patients undergoing cardiac surgery with CPB, which of the following would most likely lead to failure in weaning from CPB? A. Elevated central venous pressure, CVP. B. Low mixed venous oxygen saturation, SVO2. C. High levels of inotropic support. D. Normal sinus rhythm. Answer: B. Low mixed venous oxygen saturation, SVO2. Explanation: low mixed venous oxygen saturation, SVO2, suggests inadequate oxygen delivery to the tissues, often because of insufficient cardiac output or oxygenation. This can prevent successful weaning from CPB, as it indicates that the heart is not supplying adequate oxygen to the body. What is the most likely cause of arrhythmias during weaning from CPB? A. Overuse of anticoagulation. B. Inadequate myocardial oxygenation. C. Electrolyte imbalance. D. Excessive fluid infusion. Answer: B. Inadequate myocardial oxygenation. Explanation: arrhythmias during weaning from CPB are commonly caused by inadequate myocardial oxygenation, which can occur due to low coronary perfusion pressure or ischemia. This can trigger electrical disturbances in the heart, making it difficult to successfully wean from CPB. Which of the following is a potential complication of inadequate weaning from CPB? A. Pulmonary embolism. B. Acute renal failure. C. Liver failure. D. Paradoxical embolism. Answer: B. Acute renal failure. Explanation: inadequate weaning from CPB can lead to acute renal failure due to poor perfusion and decreased cardiac output, which results in decreased renal blood flow and oxygen delivery. Proper monitoring and timely support are crucial to prevent this complication. What is the most common pharmacological intervention used to support cardiac function during weaning from CPB? A. Anticoagulants. B. Vasopressors. C. Inotropes. D. Diuretics. Answer: C. Inotropes. Explanation: inotropes are commonly used during the weaning process to support myocardial function. These drugs increase the heart's contractility and improve cardiac output, which is essential if the heart is struggling to function independently after bypass.